anytime you get results that don't quite make sense consciously, at least check to see if the polarity is on. Pretty loud. Good, and it's back on. So, concept that there was an original event where you were afraid for saying how you felt, and that seems to be accurate. Concept that that original event happened between the ages of conception to 10. Wonder about that. 10 to 20. 10 to 15. 10. 11 years old. Can you think of anything that happened at 11?
Yes, I had some significant things happening at that time. I believe that my girlfriends told me I was a heathen and I was going to burn in hell for not having religious beliefs.
Had you talked to them about your lack of religious beliefs?
Yeah, I think we talked about a lot of different things, and I just had never really been raised with anything, so they were very religious and I wasn't. And it was fairly constant onslaught. They wanted me to go places with them and things, and I was like, I think I would feel more comfortable if you gave me a book to read.
So you opened up and they attacked?
Yes.
When you check that, and that seems to be accurate. Now what I'm going to do is check that to the kidney meridian again. It is still active, which means that the correction might well have to do with that point. You always want to check and make sure it hasn't moved, although usually it doesn't. Go ahead and put that down and relax for a moment. Now what I want to do is I also want to check to the chakra system and see if any of those points are active. So I want you to think about the episode at 11 again. And the crown is not active. And the brow is active. So we've got an active brow chakra, which is about intuition and going with your feelings, which evidently was dangerous in this instance. And we had the kidney, which was anxiety. So the concept that where we need to make the correction is in the meridian system. Wonder about that? And it seems yes. Concept that we also need to make a correction in the chakra system. And it seems like we need to do both. Now at times it will, the body will simply say meridian, other times it will say chakra, and sometimes both. What we're going to do is the meridian first, but before we do that, I want to do a global prophylactic maneuver to make sure that there is no problem with psychological reversals. So what I'm going to ask you to do is to touch right here on the sore spots of the chest.
Okay.
Yep. It's a lymph node, but it has to do with psychological reversals. Sometimes we sabotage ourselves and want to get out of something and don't want to get out of something at the same time. So what I want you to do is to roll that in a circle clockwise. So you go that way, yeah. And I want you to say, I deeply and profoundly.
I deeply and profoundly
love and accept myself.
love and accept myself.
Even though I believe.
Even though I believe.
That if I say my truth, it's going to be dangerous.
Even if I believe, if I say my truth, it's going to be dangerous.
And if you could say that 2 more times.
I deeply and profoundly love and accept myself, even if I believe, if I speak my truth, it will be dangerous. I deeply and profoundly love and accept myself, even if I believe that if I speak my truth, it will be dangerous.
Okay. Now, what I'm going to ask you to do is to touch the, localize the kidney point, go right over the emotional points, and I want you to turn. Right in here will be the correction. You could specifically go T2, 5, and 8, but we're going to take the full range because we're not chiropractors here. We're going to just make sure that we hit every one. If you put a V right there and have you think about that issue at 11, And I'm going to tap while she breathes easily. Go ahead. Breathe all the way in and hold, and all the way out. Excellent. And turn for me. Think about that issue again. We've got a strong arm. I want to make sure the kidney is strong. Hold real tight for me. Good. There's a feeling when somebody's not holding as tight as they could, and that can knock you off of good muscle testing. Check it again. Okay. Excellent. But we still have the correction on the chakra to make. So what I'm going to ask you to do is put a few fingers right here on the brow, and then your hand over the emotional points here. You can just close your eyes. I want you to think back of what those girls did. And breathe easily and deeply. Take as much time as you need. And whenever you feel a sense of relief, then you go ahead and drop that. And then you check. Look at that issue at 11. It's nice and strong, indicating that the toxicity has gone out. If you could turn your head to the left, all the way to the left, and I'm going to look to the right. Any other emotions about this issue? Now, if that had weakened, we would need to go through the process all again to see which chakra or which meridian was still up. Look right eye into my right eye. Any other emotion about that issue? And that's strong. If that was down, again, we'd have to find the chakra system or the chakra or the meridian and find out which was active. Go ahead and put that down for a second. And think of the present feeling of social anxiety. Breathe out. And how do you feel?
I feel very good.
Very, very good.
Very
Thanks,
excited.
Steph.
Thank you.